Hi, my name's Nicholas Cohen. I'm a family doctor. I've been treating high cholesterol in my patients for over a dozen years, and I want to share with you some of the important things for you to know for managing your own cholesterol. Why is it important to manage your cholesterol? Well, cholesterol builds up in your arteries and leads to essentially a clog in the blood supply to your heart and your brain. This leads to heart attack and stroke, the number one cause of death in the United States. So if you can lower your LDL cholesterol in particular, you can lower your risk of these clogs occurring in your brain and your heart and lower your risk of the number one cause of death in the US. A lot of times when we go into the doctor, we're told our numbers are okay or they're not okay, and we're given the opportunity to take a medication. Oftentimes, we're not exactly sure what's going on in the doctor's brain to say we're okay or not okay. And oftentimes, we're left wondering, is there any alternative to taking a medication? What I want to provide you with is a evidence-based approach, the way doctors do it, to determine your heart attack and stroke risk and to determine your cholesterol goals. I also want to equip you with ways of lowering your LDL cholesterol without medication. So today I'm focusing specifically on determining your cardiovascular disease risk as well as your LDL cholesterol goal. The first thing you're going to want to do is determine your blood pressure. There's going to be a top number and a bottom number, systolic and diastolic. And the next thing you're going to want to do is gather up your most recent fasting lipid panel, your cholesterol panel. This should include total cholesterol, HDL cholesterol, and LDL cholesterol. You're next going to type in to Google 10-year risk calculator, and you will find at the top this American College of Cardiology ASCVD risk estimator. Click on that link. This is what we as doctors are trained to, and guidelines tell us to use to assess your cardiovascular disease risk. So you're going to put in your age. I'm going to put in a fictitious 55-year-old white male with a blood pressure of 135/89, a total cholesterol of 209, HDL of 47, and LDL of 135. This person has no history of diabetes, never smoked, not taking blood pressure medications, not taking a cholesterol lowering medication, not on aspirin. You can see that this calculator gives this individual a 6.8% 10-year ASCVD, atherosclerotic cardiovascular disease risk. In other words, a 6.8% risk of heart attack and stroke. Now that you have your 10-year risk, you're going to determine your LDL cholesterol goal. Different societies, different guidelines differ on what to consider high risk. I will define it the most aggressively as a 5% or greater 10-year risk of heart attack or stroke. So if you determine that your 10-year risk is 5% or greater, you're going to have the most aggressive cholesterol lowering goal, which would be an LDL less than 70. On the other hand, if your 10-year risk is less than 5%, your LDL goal will be less than 100. So in summation, you're going to calculate your 10-year risk, and you are going to determine your LDL goal based on your 10-year risk. If your 10-year risk is 5% or greater, your LDL goal is less than 70. If your 10-year risk is less than 5%, your LDL goal is less than 100. This is powerful information. In my next installment next week, I'm going to help you outline a strategy for lowering your LDL cholesterol if your LDL cholesterol is not at your personal goal. Stay tuned. If you want to make sure you don't miss my next episode, sign up for my email. The link is below. See you next week.